This is a modification of a talk that was given by a dermatologist from San Francisco named Tim Berger, and I have great respect for Tim and his ability to care well for patients, and so I've adopted some of his ideas and added some of my own. But what we're going to talk about, and I just had a very question from one of the patients, is, what good is a physician? I know what I've got, I take care of it myself, and you're asking the right questions, okay? And so this is becoming an informed partner with your physician / dermatologist. One of the things you're going to find is that as a dermatologist, we look at ourselves as being experts in skin, and PC is basically a skin disease. And so we think that we ought to be the experts, but you'll find that there's a medical team that a lot of other people are interested. You've heard from a pain specialist, you'll hear from a podiatrist, other people interested in aspects of PC. This is a disclaimer. We always like to start with disclaimers, but these are some thoughts from a dermatologist about how things in an ideal world ought to work. Okay, it's interesting, and what you've already heard, and everyone sort of said the same thing. But as a resident, I saw my first case of PC when I was in the University of Michigan, and I didn't see another case of PC for 20 years. Okay. You'll see more PC in this room than most dermatologists will see in several lifetimes. And so our experience is very limited, and so we see a case of PC and we think all PC ought to be the same. And what we find out is that's not the case. And so this is why it's so important, the work that Mary has done in terms of gathering information from hundreds of patients. We now have a much better appreciation of the breadth and scope of PC. And the purpose of this is that these are my views on how a patient and a doctor can work together in the management of a rare, complex disorder with limited answers. So where can they be helpful and where are they not? For the audience, just a couple of questions, and they'll take some quick answers. But what PC-related medical problems do you take to a physician? I'm interested. When you go see a doctor, why do you go? Go ahead.
I take my children for their feet so their calluses can be managed. And
Okay.
I take them to their pediatrician if they have inflammation that I think is infected.
Okay, so who does the calluses?
A podiatrist.
Podiatrist. So a podiatrist and a pediatrician.
Yes.
Okay. Who else? What do you take to a physician?
I only go in cases with extreme cyst inflammation.
Okay.
Really large ones.
Okay, so if you have a real tender inflamed cyst, then you go get some help because it hurts. Who else? Anybody? Go ahead.
I take my children for when they seem to have nail infections.
Okay, for nail infections. Okay. And that's sort of, go ahead.
Hi. Well, I went to go see a doctor a couple years ago because I needed a handicap for my car.
Okay, they mentioned that you had to see someone to get a sticker so you didn't have to walk as far.
Yeah, but also I was in my nurse for 2 years and I went to the doctor just to educate them on PC.
And that's an important thing we're going to talk about. Okay, and this is kind of what I expected. Okay, go ahead.
When my son developed the condition, I took him to the physicians to find out what I didn't know. I didn't really know what I even had, so it took his having it for me to research it to find out what I had.
Right. So that you had it, and never really knew what you had.
That's right.
Okay, and when he was born and had the same thing, you said, "Wow."
I figured there must be some answer.
See, and we're a lot better off now than we were 6 years ago. How's that?
Exactly right.
Go ahead.
Many times it's frustrating for students, especially educating them and really getting help.
And what her comment was is that many times you go to a physician and it's frustrating because you go in and essentially you know more than they do in many ways. And so you say, gee, this cost me $75 or something to go in and tell him what I've got. Okay? So when you go to a physician, we've kind of answered this already, but what kind of physicians you see? I'm going to do just a raise of hands. How many go to a family physician when you're going to go for your PC-related problems? Okay. How many to a dermatologist? Okay. How many to a podiatrist? Okay, that's very helpful. Thank you. I put other down there, but I can't think of another, other than maybe a pain specialist. A surgeon? Okay, that'd probably be down my list. I think that
I went with pain specialist.
a pain specialist also, and that's a good one. Okay, what we're going to do, and Mary and I'm going to do it in 10 minutes here. We're going to talk about finding a physician dermatologist, and use interchangeably, not the same thing. The doctor visit, what's to take place, and then the healthcare team. There's the important things. And this is sort of the frustration that's already been expressed, but you probably need a dermatologist since PC is a skin disorder. You at least need someone who has a background that would allow them to understand some of the challenges you have with your skin. Okay, this is nails, it's tongue, it's calluses, it's feet, it's hands. These are all part of the skin, and dermatologists, in theory, ought to be the ones who have the background that can be educated. Ideally, your doctor should know. Ideally, your doctor should know about PC, okay, or is willing to learn. And that's probably the most important thing we're going to talk about. Is that you need to find someone that you're comfortable with, that's willing to become educated, and we'll suggest some ways that can happen. You need to respect or like your dermatologist. You need to be able to communicate openly with him or her. So you need to establish a relationship. You have something unusual, okay? Something that he's going to be interested in if he has any, kind of a background. And for some, that's not going to be true. But for most of them, it's going to be an interesting thing for them to learn about. But they also have to have a good relationship with an office staff where you call up and say, I've got an infection, I need some help now. Because you call a dermatologist and, well, you can't get in for 2 months. Okay, well, that's not going to help you. So that office staff needs to know who you are and be willing to work with you. And so this is a little bit trial and error. And one of the things that I would love to see us try and do would be to create a group of physicians around the country who we know of that are interested in PC. We can see, if you live in New York, here are 2 people that would like to see PC patients. And in Pennsylvania, Dr. Rubin enjoys seeing PC patients, and so forth around the country. That hasn't happened. We do have some names, but that would be an ideal thing. The office staff needs to be respectful and open and need to know, and this is forming a team to help you with your PC. Okay, so this is someone who's responsive to your needs. So the doctor visit. Okay, don't put it off if you have a problem. This is why you have good communication. If you have a cyst that's infected, you need help now, not next week. If you have a nail infection, you need to have some help now. Be clear on your visit. This should be intervals, not internals. You worry about your internals also, but this is your visit intervals. Most physicians or most patients that I would see with a rare disease, I'll see anywhere from 1 to 4 times a year. Okay, how are you doing? How things are changing? What have you tried? What works? What doesn't work? Those kinds of things. And so be clear about how often he wants to or she wants to see you. What do you do if you have an emergency? Okay, how do I get through? How do I call, and so forth. Have realistic expectations and goals, and talk to your physician, your dermatologist about those. I'm using you because I'd like this kind of information, like this kind of help. I'd like to have somebody I can get to take care of acute problems. And that's how they, so if your expectations and goals are the same, then you're going to get along well. Now, this is an interesting thing, but when you walk into a university clinic, typically, if you were to go to the Cleveland Clinic, they would say, oh my goodness, this is a patient with PC. We're going to bring them to grand rounds. Okay? You may have all been to grand rounds before. Okay? And that's because they don't see this very often, and so you become a teaching case. You become an example of something that's unusual. Some people are uncomfortable with that, and I understand that. You need to be able to comfortably say no in a nice way. If you don't want to be a grand rounds case, just say, I'd prefer not to do that. If you don't mind doing that, it's great for the residents to learn. And so that just be aware that you can say no. Go ahead.
I visit my dermatologist 4 times a year. Not so much for my PC, but with some skin blotches. And each time he has a doctor in training. A person who's about to become a dermatologist. I doctor says, take both of your shoes and stop and show it to the doctor. And the doctor goes, wow. My question to you is, how could I get 3 wows, 3 doctors who are about to become dermatologists and don't know what I have?
You're that unique.
The schools. Well,
Okay.
What schools teach this?
Well, you understand that the infrequency of when they're seeing this, there's a lot of things that they're going to see and that they deal with more often than they do with PC. And so they'll read about it in a book, but they've never seen it. Okay, so you become an example. Here's an example of PC. Okay, well, take your shoes off. Well, let's look at your nails. Let's look at your knee. They'll go home and read about it tonight. Okay, when they see you, because it's going to be a board question. Okay, they may never see another case in their life, but you're a wow. Okay,
But it is a board question, I guess. They will have. They should
That's
have
right.
heard about it.
Someone will have. Exactly. You ask them about. Oh yeah, PC. I know what I've heard that before. Have I ever seen it? Well, I saw it once. Okay, and that's exactly right. So go to the visit with a checklist of the elements of your disease and their status and your questions. Okay. So quickly, when you go to a physician, here's sort of my idea of a checklist. Here's what you come prepared with to do. Okay, he's going to want to know about your calluses, your hyperkeratosis. Talk to him about optimum management techniques. Here's what I'm doing. Here's what I find works for me. Do you have other ideas? He may say, well, let's try a keratolytic. Let's try, wrapping this at night. Let's try other things that he's understood or he's read about some ideas that may be helpful to you. The same with nails. Okay. This is a big one, okay? Pain management, and this is something that for all the world I never learned in school, okay? PC was calluses and nails. It had nothing to do with pain, okay? And when you look at a patient with calluses, they're not supposed to hurt, okay? You can scrape the callus down and the pain's gone, okay? And so that physicians who have not dealt with PC don't understand pain, all right? Or don't understand that it can be painful. So you need to know who gives you medication for pain if you're taking medication, who's monitoring that, what kind of medications are you using, and what ideas do you have. And the talk from Barbara this morning was the most helpful thing that I've heard for pain, because that kind of information I hope we can disseminate to physicians taking care of PC if we can understand better how to manage this pain. There's lots of other things, pain diaries and so forth. These are important aspects of pain that a physician would be interested in talking to you about. Then you may have specific questions like cysts or follicular hyperkeratosis, leukokeratosis, the tongue idea. If there's things that are bothering you, those are the things you do. And this is that may be every visit, it may be, that may only be once a year. Now some visits, you're going to want to know about genetics and genetic counseling, particularly if it's a new diagnosis or if it's the first time you've come, or if you have questions about that. You wonder about the prognosis. You wonder about acute issues like infections. Some visits will be driven by that acute issue. You want to do occasionally a knowledge update. What's new? What's changed? And one of the things that you can do is that as you get this newsletter and so forth, you can take that into your physician and say, here's some things we're getting from this PC project. We would be more than happy to communicate with that physician and give them information that we have about managing PC. So we can support you in terms of going and teaching them a little bit more about the disease. Do you need a second opinion? Sometimes you have a unique problem, okay, and it may be pain, for instance. They say, well, gee, I'm not a very good pain doctor, but I'd be happy to recommend you to a pain specialist. And maybe they can help you with your pain issues or your nail issues or things like that. And then are there emotional issues with PC? Okay? Special circumstances, children, particularly if it's a new mutation, you have a child and they have PC, no one in your family has PC, and that happens about 40% of the time almost in our studies, that it's a new mutation. Okay? Adolescents with PC. Adolescents have a unique time of life. They're trying to fit into the world and don't know quite how they fit. And so that self-esteem issues, limitations, how do you deal with them? When I can't walk, when I can't do sports at school, how do I deal with that? Management techniques are very important. So what we're trying to build here is a healthcare team. You should have some type of a primary care physician, and that could be the dermatologist, although you ought to have someone who takes care of your lungs and your heart and so forth as well, that really functions in that role. And then a primary person you see for updates in terms of your PC, a pediatric dermatologist, someone interested in PC. And that's the key to this whole thing, is someone who understands you and understands your disease. You may also need subspecialists, and you also need a podiatrist. They're very helpful in this aspect, and we're going to hear from them next. Pain management, physical therapist, occupational therapist. So you'll have people that can help you with unique problems, and that may be often or it may be infrequently, but you ought to have at least an idea of what a healthcare team can do and should do for you. So my opinion, in rare persistent diseases such as PC, more healing occurs through communication, the sharing of knowledge, and empowerment than through medical treatments. And this is kind of what you said, is that you go to them and you say, I know more than they do. Why am I wasting my time? Okay? Well, between creating a knowledgeable physician and then sharing knowledge, giving you some empowerment to take care of your disease, will do more than we have for medical treatments, although we're working on the aspect of medical treatments. Any questions, anything we ought to discuss regarding that, regarding physicians? Great. Al, you're up.
Thank you.
You bet.